So, good morning, YouTube. I'm just waking up. I worked a double yesterday, and I'm dying. I have to go back to work today in a couple hours. It's like 11 o'clock. If you see anything, I ain't washed my face. I ain't brushed my teeth. It is what it is. But I just wanted to talk to you guys. Let me see if I open this. Will I look a little bit decent? My robe's inside out. Whatever. So I wanted to talk to you guys because, yesterday I had an interesting day. I feel like every day I go into work now, it's just a really interesting day. So I'm gonna try to spare the details, but I had a patient that, was complaining of discomfort, that had a catheter in, but was like straining to urinate. If you don't know what a catheter is, it's basically they put a line to your bladder and the urine will come out automatically. Sorry, but this patient, he was straining, and if you have a catheter in, you shouldn't be straining. The urine should be coming out automatically. So I used my nursing judgment, and yes, there was a problem. But it turns out, like, every time I work, it's always a problem. And I asked the patient, he's alert, she's alert, it's alert, it's alert. And the patient was like 2 to 3 days they've been feeling like this. So, I love what I do, but it's a little frustrating that, when I have to come in and I only work mostly the weekends, that I have to come in and fix it, I'm the youngest person that works at my job. I'm 25. Everyone else has been there for years. It's just frustrating when, you have to go in and basically be Captain Save-A-Ho, basically, and save your patient. Because if I would have waited any longer, that patient's bladder, who knows what it would have happened, because it was definitely full and retaining urine. So who knows, caused inflammation and all. So I don't know why I made this video. I love what I do, and yes, I'm learning. Still, I'm not a perfect nurse, I get that, but you have to have the passion behind nursing. You really do. And I don't just say this for fun. You have to have the passion behind nursing, because if you're doing it for the money, your ass is always gonna be broke. Because as much as people think when they hear nurse, the money is decent, it's alright, but you still have to work just like others. If the money was so good, why would we work so hard? Who wants to kill themselves? 3 days a week, 12 hours, when you could be home working 1 day a week if the money's so good, you know what I mean? So you'll never be happy with that, and then you'll never be happy because you have to actually talk with patients, communicate with patients. And the funny thing is, like, people say, oh, geriatrics, old people, they don't want to work with those. But for me, I don't know, I love what I do. I love that, my patients can talk to me and interact with me, if it's not into a severe situation. I love that they're able to laugh with me at my jokes, I have a patient always, when you getting married? Are you married yet? Did you get married? What you waiting on? Like, just little things like that I love. And I don't know. It's just such a vast career that it's awesome. It's just a blessing, in my opinion. I don't know. This is just a little rant / like just getting my feelings out. So I hope you like the content. I'll probably take you guys to work with me today since I'm not working a double. But yeah, hope you guys have a good day, and yeah. Subscribe if you haven't subscribed. Comment down below your thoughts and your feelings on nursing. If you are a nurse, why did you become a nurse? If you are in nursing school, what kind of population would you like to work with? And just your thoughts and feelings on the whole. I mean, I know nursing is you find it, you do it, like that kind of thing. But I feel like a lot of nurses nowadays are lacking the skills that they need. Here I go ranting again. Lacking the skills that they need to actually be a nurse. They lack that critical thinking. They really have no critical thinking skills and are, no offense, kind of useless because they don't, I don't know, they just, it's weird. Like they don't have that thinking, upper level thinking as to like, okay, if this, my patient is feeling this, let me go investigate, call the doctor with my results, and then see what the doctor does. Like, oh, the patient said this, oh, that's different, that's strange, let me follow up and call the doctor. They're not doing that nowadays. So that's a big reason why I take part in, you know, try to do my best when I'm at work and just, you know, make sure all my patients are okay. Being in nursing school and walking around with those nurses at the hospital, they do focus assessments. So, you know, of course, I'm making my rounds. As I'm passing my meds, I'm doing focus assessments. Oh, my patient has an amputee. Let me look at that foot and check, you know, for pulses. Oh, my patient has, what else? A fistula, like for dialysis. Oh, let me check that Brutonthal right then and there when I'm giving them their meds and check out anything else that they have, their peg tube site, or, you know, anything like that. Just doing my focus assessment. Oh, you're on an antibiotic. Have you had any diarrhea? They're not doing that nowadays. And yeah, I get it. The nursing home is definitely not a place that gives you time. You have 20 to 30 patients, but you have to just do your best. For me, I feel like if I did my best at the end of the day, then it is what it is. Anyways, the chitlins are waking up. They're not my kids, but you would think I have 4 kids because the way people be talking. So, have a good day. Bye.